in the chat during the presentation. We may just hold off and circle back to you as we conclude today. So with that, I want to welcome everyone once more to our ESAS broadcast today, Professional Readiness, Attitudes and Values. As most of you know by now, this event is being brought to you by the National American Indian Alaska Native ATTC. We are located here at the University of Iowa. I'm broadcasting to you live from the College of Public Health here on campus. We are part of a much larger ATTC network, including 10 regional centers, a National Hispanic and Latino Center, as well as a ATTC network coordinating office located at the University of Missouri. Let's see if I can move my slides along here. Again, most of you are aware, this project, our broadcasts, the things that we do here at our center, we are funded and supported through SAMHSA. The content is developed by the presenter and our center, and the opinions expressed today do not necessarily reflect the views or policies of SAMHSA, HHS, or the American Indian Alaska Native ATTC. Following today's event, we will reach out to you via email. We will include PDF versions of the slides today so that you might be able to reference those or share those with a colleague. We'll also be recording today's event, and this event will be a recorded version of this event will be available at our YouTube archive page that we will also include in the follow-up email so that you might be able to come back to this or reference this to a colleague or a friend. We are going to offer 1.5 NADAC approved CEUs today. So again, when you receive that follow-up email, you can request at that time a certificate of attendance, and then you can apply those to your licensing or certification board in your respective state. So happy to do that for all of you. And lastly, there'll be a link to a very short survey. The survey is not mandatory, but we would love to hear back from you. We appreciate your feedback, and it also sends a message to our funder that we are providing a service, and we do have an audience that is attending. So if you can take a few moments to complete that survey, we would really appreciate it. All of your answers are confidential. None of it can be linked to you personally in any way. If you have any questions about that survey, you can reach out to me here at the center, and I'm happy to speak with you or correspond with you via email. So thank you so much for being with us today. Before I turn the floor over to my colleague, I want to take a few moments. I know we're gathered virtually today, but we do want to take some time to acknowledge the land and pay respect to the indigenous nations whose homelands were forcibly taken and inhabited. Please take a moment to read this land acknowledgement, which was created by 3 members of our team, Ella and Keely Driscoll and Mr. Sean Bear. Thank you. Well, without further ado, I want to introduce my colleague and friend, Dr. Avis Garcia. She is an enrolled member of the Northern Arapaho tribe and is affiliated with the Eastern Shoshone tribes of the Wind River Reservation in Wyoming. I know she's coming to us from the great state of Montana, and I know that she is a licensed professional counselor and also has a significant background working in the addictions field, as well as families, adolescents, with a variety of co-occurring or comorbid issues. She's got, I'm going to say it again, Avis, she's got over 20 years of experience. We both sort of scratch our heads and wonder, how really it's been that long. I also spent some time in the clinical setting. So really happy to have Avis here with us. She brings to the table a variety of clinical experiences, as well as some lived experiences that she often references, as well as a cultural perspective and how that applies to the content of what we are going to be discussing today in the behavioral health world. So without further ado, I want to turn the floor over to Dr. Garcia. Just as a reminder, before we do, you are currently muted. I would just ask that everyone make sure you stay muted so that we cut down on background noise, and use the chat box feature or the hand raise feature if you have any comments or would like to unmute and share a comment or question. So I've said enough. I'm going to hit my own mute button now. And while Avis introduces herself a bit more, I'm going to transition into the next slide deck. So thank you again, everyone, for joining us.
Good morning or good afternoon, wherever you're tuning in from. I can't believe it's been 20 years since I've been working in the field of mental health and substance abuse. I am currently serving as the Clinical Services Director for the Crow Tribe's substance abuse program. We go by the name of Absolute Healing, and we provide outpatient substance abuse treatment and referral to residential on a case-by-case basis. We also serve adolescents, and we do a lot of prevention in the form of public education and events in the community here. I am from the Wind River Reservation in Wyoming. My home base is Ethity, and so I spent most of my life on the reservation and a good part of my professional career working off the reservation, only because I wanted to learn how things work. I call it the real world, and be able to take that knowledge and apply it to places like where I'm at now. Like, I got to learn a lot about CARF accreditation and the entire process. And that was probably one of the main things that brought me to the job here, was they needed somebody who could assist them with that process. So I'm happy to be here. I haven't been here a year yet, and I feel like I'm really settled in now. Like, I'm really enjoying Montana, especially the outdoors. It's very beautiful here. I'm an outdoorsy kind of person, so now that the weather is starting to get nice, I'm really enjoying it. I have been with the Addiction Technology Transfer Center since 2019, and I've done a lot of presentations on a variety of topics, and I'm always open to suggestions and special requests. So if there's something you're thinking about, if you'll get that information to Steve, he's usually pretty good about facilitating, setting up special trainings if needed. I have been doing this is my second year to go through this series of ESAS slides to help prepare people for sitting for the substance abuse licensing or certification exams, whatever your state requires. Every state requires different exams, and I took the exam through NADAC, and I think I graduated in 2001 in addictions from the University of Wyoming with my master's degree. And at that time, we were required to pass the exams to graduate. I am dually licensed. I have a mental, I am a professional counselor in Wyoming, and in Montana, it's LCPC. and I'm an addictions therapist in Wyoming, and here it's called licensed addiction counselor, so I'm an LAC. So I'm dually licensed to provide both addictions and mental health services. And today's topic that we're going to be covering is professional readiness, attitudes, and values. So this is a good one. I'm kind of excited to present this one today. So like I said, if you have any questions, put them in the chat box. And when I'm done here, we'll go through your questions and I'll do the best to answer them for you. Today, we're going to cover clarification of our values, what's important to us in our work and our lives, look at some cultural considerations. Of course, we're here to help our Native people. Talk about building trust, which is very important to working with Native people, and sharing some steps to engaging American Indians and Alaska Native patients. Talk about supervision, and last but not least, self-care, being able to manage stress, and not just for ourselves, but to help our clients too. Okay, to clarify our values, what are the standards of care that guide your work? So that means your education and your training should match the work that you're doing. So questions you might ask yourself is, where are my knowledge and skills best used? Am I getting the support I need to help the people we serve? It's very important to be able to ask for that help when you know you need it. And does my individual practice, my standards and values conflict with the organization's expectations? So most agencies have a mission statement and or a vision statement that will list your agency's values and their core mission to how they will serve people in their communities. So you want to look at what brings you here, and ask yourself, why are you here? Why are you doing the work that you're doing today? You really have to have a heart for this work, because this is a very challenging job, and so it's really important to be aware of your values and consider those when you seek employment. So a clarification of values. These standards may be set by an agency that you work for. We can ask ourselves, what is your agency's mission and goals? Whose needs are being met? Ours are the patient. So we need to be very careful in being mindful of those boundaries, professional boundaries, and that we're not there to get our needs met. That would be unethical if we did that. So we're there to serve the patient. They're like our customers. They come first in our work from day to day. How we improve upon our services to meet the patient's needs. So we often have to take their input into consideration in providing. Here, one of our values is providing person-centered services. So that is allowing the client to have some feeling of ownership and coming up with a direction of the care that they receive while they're receiving treatment here. You can go to the next slide. More on the clarification of our values. Again, standards can be set forth by the profession. This one is an example of social workers. I would go by the American Counseling Association as a professional counselor. And in the substance abuse field, I highly encourage everyone to seek membership into NADAC, which is the substance abuse certification. And that is the code of ethics that I use here at this agency that I work. I have all of my staff. Once a year, they have to review the code of ethics for NADAC, which is for the addiction counselors. So knowing, the ethics of the profession. More on clarification of our values. It's having a commitment to the patients. Just like I said, our patients are our customers. They're the reasons we do the work that we do. They're the reasons we have these programs that we have. So it's always important that we're promoting the well-being of our patients and that their interests are the primary issues that we address. We need to look at self-determination. So that includes respecting and promoting the rights of patients to make decisions in their own lives and to advocate on their behalf as well. Also, cultural competence and social diversity. So that includes understanding the nature of the social diversity, oppression with respect to race, ethnicity, national origin, color, sex, sexual orientation, gender identity, or expression, age, marital status, political beliefs, religion, immigration status, mental and or physical disability. So it's very broad when it comes to looking at cultural competence and social diversity. And I'm not a huge fan of the word competence because I don't believe we can ever be fully competent in another, I'd say, race or ethnicity background. I like to consider myself a lifelong learner, so I'm always open to learning more about other cultures as well as my own. And and the gender identities. Several years ago, we used to have forms where you just check the box, male or female, and now CARF requires us to expand those choices there so that patients who choose to identify as, gay or, transgendered, whatever they identify themselves as, that we have those options available for them so that they feel included and not forced to choose that they're not comfortable with. We can go to the next slide. The definition of culture. The word culture describes an integrated pattern of human behavior that includes communications, actions, custom, belief, values, and institutions of racial, ethnic, religious, or social groups. Again, this is an ethical mandate by the American Counseling Association. This one here points out that social work has that standard, and NADAC also includes it. And that is just being mindful of the different people that we work with. I am a Northern Arapaho, and I'm also Eastern Shoshone, but those of you that are enrolled members of a tribe, you know that you can only belong to one tribe. So I was raised by my grandparents who are Arapaho, so I identify as Arapaho. And now we're not all full-blooded. We have different tribes that we've intermarried because, we have our ways of finding a partner in our life that, relatives is a no-no. So a lot of us have married into other tribes, and I have a son who is enrolled Shoshone, but he considers himself Arapaho because he practices the Arapaho ways and not the Shoshone ways. So it's finding a full-blooded native is kind of a rare thing now, but there are a lot of them here in the area where I live. I'm in Crow country, so I have to be mindful of this other tribe that I'm working with. I can't just barge in here and start doing things without respecting their culture. And for that very reason, I have a cultural counselor that I brought on board who's like my personal consultant, who I can often check in with him as I do my work here so that I don't offend anyone or do anything wrong, and that I'm respectful of their ways. So I've been finding similarities and some differences in our cultural beliefs as different tribes as I work here. Go to the next slide. More cultural considerations. Again, the Native specific cultural risk factors. The number one thing is trust. So we have to be mindful of that lack of confidentiality, the lack of social services, rural or reservation, limited access to comprehensive health care, the circular migration. My home is 5 hours from here, so I go home quite often. And a lot of times there are natives of other tribes that live in urban areas or just other states like myself. And because I am Arapaho, I will go home for celebrations, for ceremonies, you know, a lot of things that I do aren't readily available here. So I am able to go home, and I know a lot of other natives from other tribes do the same thing. I have friends that live here that are from North Dakota, and they're often going to North Dakota. So we seem to have that tie to our home reservations. There are the unresolved traumas, historical and otherwise, such as the urban relocation programs that were popular in the late 50s, early 60s, boarding schools. We all know about the history of abuse that continues to surface as they continue to look, and that abuse includes sexual or otherwise. I have someone here who is from Canada that works for us, and he, you know, has shared some interesting information of what's taking place with his tribe up in Canada regarding the boarding school situation that's been a hot topic in the news lately, sadly. And the racism, the homophobia, the transphobia, and biphobia. So there's all these different things that we need to be mindful of. And trust is a big one for most natives, and that's the first thing we need to be respectful of. Next slide. Okay, here's a question for all of you out there. What comes to mind when you think of cultural competency? I can't help but think of, have become friends with the director of behavioral health at Indian Health Services, and her name is Dr. Chapman. And I'm just fascinated that she's spent probably as many years as I have working for Indian Health Services. She was on another reservation before she moved here to the Crow Agency, and just how much knowledge and experience she has as a non-native psychologist. And she has shared a lot of her experience. And then there's times she actually wants to ask me questions because she thinks I'm an expert because I'm a native working in this field. So it's been great for me to have someone that I can consult with in working with clients. So I've been really trying to work to integrate with the behavioral health services here with our treatment program. So I see her as someone who has, you know, I don't know, being fully competent. Like I said, that word competent, I think cultural relevancy, cultural sensitivity, I think just being mindful of different cultures. Like I said, that word kind of, it doesn't sit well with me, but it is something that comes out in the work that we do. And it's always emphasized that, you know, we can't discriminate and, you know, judge. And I often point that out to people, you know, in our work, that we can't frown on other people, and we need to be mindful of our own biases and the different groups of people that we work with. Go to the next slide.
Marcita Eaglebear says, in response to this question, she said, someone who is respectful and mindful of cultural boundaries is the beginning, she says. And Ayana says, willingness to understand where the person is coming from.
I like those. Those are very good. Thanks for sharing that.
And one more, Colleen says, knowing and continuing to understand other cultures. So those are good.
Yeah, those are really good. Thank you, guys. Cultural humility. this is the word I like this one. This is probably what I prefer. And it's just another way to view this concept. It incorporates a lifelong commitment to self-evaluation and critique. So like I said, being a lifelong learner, I'm always open to what would be effective in the work that I do that wouldn't, cross anybody's boundaries or offend anyone. So redressing the power imbalances in the physician and patient dynamic, and developing mutually beneficial and non-paternalistic partnerships with communities on behalf of individuals. So that is being able to just being mindful of the people that you're working with and never presenting yourself and walking into a room. Myself, for example, my culture as an Arapaho person, I was taught that because I have education, that I don't lead with that, or I don't put myself above people. I've kind of had different viewpoints from different people in my family about how I approach it. But again, it comes from how I was raised by my grandparents, who were both Arapaho. And so even in my work here, I don't go introduce myself as Dr. Garcia, but when I'm doing presentations such as I'm doing today, I'll present myself as Dr. Garcia, especially when it comes to a teaching setting. When I'm working with these clients here, I present myself, as I'm Avis, and I'm the same as everybody that's here. And that is just how the Arapaho culture looks at leadership, is we're all on the same level. It's not this hierarchical that is in Western society that kind of puts this person at the top and it branches on down to the bottom. We look at leadership as, we're all playing on the same level here. So that's how I approach people in my work. And I like when I have clients here that come in that just want to be here and that they ask for me, and it makes me feel, I guess, more accepted, and that they trust me when they come in and ask for me by my name. So that's just my little spiel on cultural humility. Some key distinctions from cultural competency is that it acknowledges we can never become truly competent in another's culture. We just can't. It requires a simultaneous process of ongoing self-reflection and commitment to lifelong learning. So that self-reflection can be, taking some time to journal or discuss with other people that work in your profession how your work is going, and maybe some thoughts that you're having. Works to redress power imbalances and develop mutually beneficial relationships with communities and individuals. So again, those power issues, if you're looking at gaining trust of people, you don't want to come from an authoritarian or a paternalistic viewpoint. You want to be, as we natives say, humble. Again, the cultural considerations, the last I know, there are 573 federally recognized tribes in the lower 48 states. The Alaska Native people, I'm just amazed at how many different tribal communities they have there. 231 tribal communities there. So we're all different. We all speak a different language. We all like our different foods. We all have our different ceremonies. Like I said, there are some similarities, and there are a lot of those differences in the way we value our life. And it's not just not being a tribe, it's also doing like your own mini cultural assessment of, I have people that come to this agency that are Crow, and because I have a cultural counselor and I try to be mindful in providing culturally relevant services, how do they identify themselves as, are they, fully traditional? And these people here, I love that they have their language pretty intact in this Crow country. And so a lot of my staff, I guess all of them, speak the language very fluently. And so I'm learning the more time that I spend here. And some of their words are real similar to mine, but just knowing that we have those differences, but not only the different tribes, but the different levels of assimilation. There are some Native people, I've had them in my own family, that want nothing to do with our traditional ceremonies. They're like, they just shun it and do not participate. And then we have those, well, like my son, for example, who really took to my grandparents and took in everything that they taught him. So some people practice, their traditional ceremonies. And then I have people here that I said are Crow that are fully religious, like they are into the Christian movement and these, I don't know, I'm not familiar with them because that's not what I practice. So they have these tents here where they invite people to come, and I really feel like maybe I need to put some more knowledge into the religious aspects, because when I do my assessment of people myself, I want to see, well, what do they want? And then there's people that just want to learn. Maybe they grew up in that home environment where those types of cultural things weren't passed down to them. So I'm very glad that we have someone who's respected in this community as a cultural leader, that we can make those connections for them to learn more about the Crow culture here. Building trust, the cornerstone for all communities that we work with. So that includes being non-judgmental, not being, right or wrong, setting aside whatever personal biases we might have, being strengths-based, identifying behaviors that support a healthy lifestyle. Hey, you're here today, you made a really good choice, and you're working on yourself. Just pointing out everything. It's really, strengths-based is really perfect for working with Native American people, because some people have really, by the time they get here, I really feel like a lot of their self-esteem has really gone down, or maybe it was never built up to begin with. So anything you can do to encourage their strengths that they have. Being authentic, a personal connection helps build that therapeutic relationship. So I remember when I first got into the counseling profession, I felt like I had to be somebody I wasn't. So I kind of struggled. So when I finally reached the point where I'm just being me, that's why I love working with Native people opposed to non-natives, because I'm more comfortable there. I feel like I fit in and I belong, and I can just be myself. I don't feel like I'm trying to bend myself to fit something else. So it's important to take that time to establish a connection before work can be done. This is very specific with Natives. Introductions are important. We started today's presentation, as I start all presentations, most of what I do, identifying who I am and where I come from, what tribe I represent. So that is just customary introductions for most Native people. They want to know, then once after you introduce yourself, I know they want to know who's your family and where you come from. And here we find that it's a small world here in Crow country, that I actually have some relatives that have moved here and married into the Crow tribe. So a lot of times they're asking me if I know certain people because they have relatives or family that's married into my tribe back home. And, we can't make assumptions regarding sexual behavior, no assumptions regarding sexual orientation. We leave that up to them to identify and share that information about themselves and what makes them comfortable. We can go to the next slide. More on building trust. We want to be able to offer a nutritious snack, apples, oranges. I don't like raisins. Protein bars, sugar-free drinks. We want to, for some of these people, sadly, and I brought this up at some of my major directors meetings that I've been invited to, that these people are living below poverty, most of them. We get a few people that are referred that, are working and have jobs. But for the majority, we have people that might not have anything to eat at all at home. And I've really struggled with, because it's our funding source also restricts our ability to provide food. So I'm always happy when I can seek resources that allows us to buy food, to have stuff readily available for people here. And it is customary to offer something. Like I said, this can be as simple as offering a glass of water. I was raised as an Arapaho. Whenever somebody came to the house, my grandma always offered coffee, or make a sandwich, or if we just got through having a meal, or we had a meal, to fix themselves a plate and make themselves at home. Or it's just a customary practice, and I see that to be quite common in other Native families, and also Latino families. I feel like there's a lot of, I feel comfortable around that, the Latino population as well, because there's just a lot of similarities in the way we live life. Meeting at a place of their choice, creating ease for the patient. Maybe you need to meet them outdoors, at a park, another town if possible, or maybe they need transportation. So there's some people here that can't even afford transportation. So we were able to work out with the tribal transportation program. One of our workers actually made these passes that looks like a real official pass here. And so they can get free rides here, and the tribe takes care of those costs for the people that need a ride to get to group. If possible, rearranging the furniture, removing any barriers to communication. And I have not done it here, but back on my reservation where I come from, I have been invited to the homes. And thinking as an Arapaho person that, sometimes when we're back home, we might invite, well, my grandparents would bring the medicine man in, or the cultural elder in, and so they would come to our home. And so sometimes I would approach it that way back home. I would get invited by families. They had someone that they wanted to help, but that person didn't want to come to the office. So knowing that it was going to be safe, that the family was going to be there, I would be open to approaching and going into the home to meet the person that they wanted to help. Rearranging furniture, any barriers. We're planning to set a teepee up out here this summer. Our cultural counselor has been doing a lot of work with the teepee. They've been making teepees out of willows, of sticks, so that they learn the significance of everything that's involved in just building the teepee. And our plan is to set it up outside so we can go sit in there and have our groups and sit on the ground like we're comfortable doing. Go to the next slide. Again, affirming Native culture and heritage, asking about their nation and their community. Utilizing supportive family connections. You want to include the family as much as you possibly can. Accessing cultural knowledge and spiritual practices. Like I said, I don't know if you all have the privilege to have a cultural counselor on your team, but I'm so grateful that I have that here. And I know the other programs that I've worked with back home where I'm from, they also have a cultural counselor on board. There's also providing incentives. There is literature and research that's been done that shows providing incentives can be beneficial and proven effective for people that attend treatment services. I just asked our next leadership program if they would have this tribe that's running a really cool MAT program to highlight how they're doing their program, because they shared incentives that they're giving for clean UAs, like they're making hygiene packs for them. So even though we were talking about some people not having food, they were talking about some of our people just need basic hygiene stuff. And today, right now, the agency that I'm working with, they're going to the park in the nearest town to feed the people that are in the street. You know, they're gonna take them a bowl of soup and a piece of fry bread, and we're gonna try to reach those people that want help to get them connected with some treatment. So it's, I'm really glad that we're able to reach out like that. More on building trust. Service providers work from a positive service delivery model. Again, strength-based is huge. You want to collaborate, identify, and exemplify strengths as a way to empower them. You know, watching these people and pointing out the things that they do really well, so it builds them up and gives them some pride in themselves. Convey authentic interest, also known as mindfulness. Acknowledge and provide support for positive steps already made. One example is returning for another appointment. People in care live longer and do better than those who are not in care. And advocacy, that's that frontline perspective. So we always have to be here to support these people and whatever help we can offer them. And sometimes that includes our being able to advocate on their behalf. You know, I've had some of my counselors, they don't do it all the time, but at times they have gone to court to tell how well somebody has been doing in the program. You know, they've been coming to treatment and, you know, they're working and like they're doing really good. So it makes me feel good when one of the counselors that I have wants to go to court because they've been asked if they would go and speak on behalf of that person. Go to the next slide. Building trust may require us to meet challenging systems like whose needs are being met. Again, this is being mindful of we're not there to serve our own needs, we're there to help the people. So an office, for example, having your office located where the community infrequently visits, we are kind of like really, I want to say we are north of the main tribal area, and we have a parking lot out front and we have a parking lot in back, and the parking lot in the front area was supposed to be for people, for our customers, our clients to be parking, but a lot of them choose to come park in the back because they're parking behind the building where they can't be seen. And, you know, being mindful of their needs and what they want, we want to be able to provide them with what's going to make them feel comfortable. So we no longer tell them that they can't park there. If they want to park there in their space, that's fine. You know, that if that's what makes them comfortable in being here, they're welcome to park in the back as well. That's just because they don't want their people to know that they're here, which is fine. Looking at the complex organizational process, barriers and steps, the intake forms reflect diverse patients. Again, CARF has really made a lot of suggestions for making changes in the intake forms that we have. So those are some new things that we've done recently, and not overburdening them with a lot of paperwork. So we've minimized a lot of paperwork recently, and implementing programs where providers do not reflect the community served. So we need to be mindful of the programs and the services that we do offer, that they're something that they want, are open to participating in. One of the trainings that my staff are all going to be attending this next week is called the Good Road to Life. And I participated in this training about 10 years ago, and I was really impressed with it it was used on the Wind River Reservation and continues to be used there in one of the programs that I know on the reservation. So I'm really excited to be bringing that here because the person who created that curriculum actually is from Montana. He's of another tribe, but he has a really good program, and I'm looking to implement that here. So that is to meet the client's needs. We need to be mindful, and those of us as supervisors need to be mindful of the people that work with us, that they are keeping those professional boundaries in place. More on building trust, other barriers to solutions, service providers, personal bias, limited referral resources, lack of funding, unrealistic timeframes, and more. So there's all these other barriers that we encounter in our work, depending on where you're at and what resources you have. We have, I'm actually tapped into resources that are available to my community on my reservation. So we don't have a lot of treatment programs, residential treatment programs ready to send people to. So we oftentimes have to send people to other states where we have those. Looking at funding, what type of funding do they have? We have limited funding. So we don't just send people off to treatment. We do a lot of outpatient treatment here. And then the service providers' personal bias. I had heard that some people, maybe they break a rule or whatever, and they tell them that they can't come back to treatment. And I'm like, I don't know whose idea that was, but we can't do that. We still need to be able to meet their needs. That's why we're here, So unrealistic timeframes and others. So I really feel like we have to, again, we have to follow what CARF requires us to do. So that kind of sets the standard for our outpatient treatment programs of how many hours. And always talk, they are always bringing up evidence-based. So I'm always advocating for our best practices, because natives don't have a lot of evidence-based programs. There's just not enough research to support a lot of evidence-based programs that are out there. But when you have 20 years of experience like I do, you're able to look at some things objectively and just know from reading and seeing it in action if it's something that will be effective and work with Native people. So we don't want to enforce them to do anything that they're not comfortable with.
Just want to clarify, over 20 years of experience.
And I'm often consulted on, that other people's ideas of things that they want to implement in their program. Okay, go to the next slide. Okay, confidentiality, issues of drug use, sex, sexual identities, gender identities, anything that might be highly stigmatized in Native communities. So I've often heard of people referring to people that use drugs as those people. And here in Montana, and it's on my reservation, and I'm assuming it's on other reservations as well, is, we have that homeless population. And back home on my reservation, they call them the park rangers, and here they're referred to as just street chiefs. So each area has names for the people that are frequenting the streets, that are struggling with substance abuse on a day-to-day basis. And it's not just substance abuse, it's mental health issues too. So oftentimes, not only do we need to help them with treatment, we need to connect them to mental health and psychiatric services. So it's critical we maintain the highest level of confidentiality if we're serious about improving the quality of life for all people. So that's where the professional disclosure statement comes into place, of letting them know, everything you share here will be confidential, except, if you're a danger to yourself or to someone else, those are things that I'm required to report, those types of things. Native people have a personal family experience breaches of confidentiality. So a lot of these people that work here are related to a lot of the people that come into the program. So sometimes they'll even let me know, somebody, a certain person is coming and I can't see them. And which was the same way for me when I was back home. Before I would see any patients, I would tell them I need to see the list of the names, because, it could be my brother or my cousin or somebody, and, professionally, we can't work with them. And then I've also had the other experience of my family getting upset with me because I tell them I can't see them and them not fully understanding why I can't. Next slide. Breach, a disclosure to a third party without consent or court order of private information that the physician has learned within the patient-physician relationship. So we can't disclose any of that information. And we all have releases of information forms. Some of them are required. If they're referred to us by the court system, they have to sign a statement that says they will, know that we will be letting them know if they're showing up to their appointments or if they completed, and also letting them know that, there's those certain situations, if, somebody might be suicidal, that, we have to get help for them when it comes to a life or death situation. Again, this disclosure can be oral or written, by phone, fax, electronically, via email or health information networks. And our form actually has like specific things that they can say that they want shared and not shared. So being able to build that trust is really important. Steve is reminding me of this, the 42 CFR and the HIPAA. I am on this reservation and almost daily this phone rings with moms with adult children and them wanting to, get help. I understand that they want to get help for their family members, but then I have to explain to them, the person you're calling to me about is an adult. So legally and according to HIPAA and all these confidentiality things, they need to make this call. We can't have you doing that unless they want to come and sign a release of information for us that says we can even talk to you. So that's a daily thing here. And I have a new receptionist here. So I'm trying to remind her that we can't give out any information when parents are calling, and, unless they're a minor and that we're obligated to give them that information. Trust impacts the quality of care. If you want to have high quality health care, and be able to complete the health assessment and being able to get the patient referrals, you want to have the trust. They need to know that this is a safe agency. I get people in this community that do want help, and sometimes it's through another party, and they will contact me, and because of that trust issue, they've actually said, I want to come in, but I don't want to be there when there's a lot of people there. I mean, that's how much they have the trust issue. So I have changed the hours here to where we offer evening programs, and if somebody wants to get an evaluation like at a different time, I'll make sure that somebody will be here to see that person at a time that they're more comfortable with, so that I really feel that builds trust for helping the people that need it. One of the biggest mistakes we make is assuming that other people think the way we think, and no two people thinks exactly alike. We all have our differences of opinion and just about everything that's out there. We're having an old building demolished next door, and one of the construction guys came in and went on and on about the vaccines, and then he stopped himself and says, I probably shouldn't be here. saying all of this, and I was like, everyone's entitled to their own opinion, and you're not really doing anything wrong. So we can't emphasize that enough, that some people that are out in this community don't understand how things are done here. So sometimes I get people that are very upset until I, point out to them that this is just the way things are. And sometimes my staff have to deal with that, and they're like, so and so, somebody's parent wants to talk to you because they don't understand. And so again, they're just hearing the same thing, just coming from the director, I guess, is what they want to hear. So oftentimes I have to have my door open to be able to address situations as they arise. Steps to engaging our Native patients: knowledge of the Native-centric worldviews, just, how we live life in general, understanding the roles of Western medicine and, how that can be different from our Native viewpoints and our Native beliefs. Again, those formal introductions, explaining confidentiality to them so that they're comfortable. We have signs out in the waiting area where I work here that says, what you see here, leave it here when you leave here. Again, respecting confidentiality. We have them sign it in the group room. We have sign on the wall. So it's just constantly reminding confidentiality. We have a new cleaning person, and I had them sign a confidentiality statement, and I have to explain to them, you can't leave here and go talk about people that you saw here. So that's why I need you to sign the statement. And then giving them times that I would rather they come in to do cleaning, so that there's not a lot of traffic of customers here, to further protect client confidentiality, and understanding that circular migration. And again, that is just Natives like myself who will go back home for certain events that are taking place in my own community, but coming back here because this is where I live and work. And like I said, a lot of Natives do that. My friend's daughter is living in Seattle now, and she said, my daughter came home to visit because she just graduated from college, but her daughter is like really liking Seattle and she's gonna stay there. So my friend, who's her mother, is a little upset that her daughter's gonna stay there. And I said, well, you know what, it's good for her to experience life off the reservation and to see what the world is all about. So again, they have their events here that happens in the Crow tribe that she'll probably be back for the Crow Fair, the big powwow celebration that they have here. So I've learned a lot about the Crow Fair just being here. And to me, as an outsider, it was always just a big powwow. And having been here and lived here and understanding that this event is a huge part of culture, and there's a lot of ceremony involved in it than I ever imagined. So to me, it's just really expanded my cultural knowledge of another tribe and their way of life. The knowledge of Native-centric worldviews. Many Native people do not conceptualize themselves as most important. Our membership to our tribe is most important. And I've learned this in doing my research on education, that most of us that go away to college to earn a degree, we don't oftentimes do that for ourselves. We want to do it because we want to help the people. And we want, our family is important and our community is important. And like I said, I was raised by my grandparents, so I was often reminded that I represent my family, and to keep that in mind and how I carry myself and conduct my life as I venture out into the world. And our family includes others, not just blood relatives. It includes your in-laws and people of the same clan, your distant relations, others in the community, and adopted members. I have family that I did not know were not blood relatives, but they were adopted. So my grandparents adopted several people that all this time I was like, that's Uncle Jim, you know, and Aunt Betty. And I come to find out it's just people that they adopted. And as I've gotten older in my own life, I have a lot of kids that I've adopted, just like my grandparents did. So I, you know, I have someone back home who, actually a few more, you know, that I've mentored who've gone on to college and are doing good things in their life too, that I consider my children, and they might call me their mom or their second mom, or maybe they lost their mom or didn't have their mom for most of their life. So they've kind of just come under my wing. And I was raised to treat my children's friends as my children. So when they come into my home, they're, you know, there to make themselves at home. Like I said, this is just the way we live our lives as Native people. Knowledge of the Native-centric worldviews continued. In contrast, most medical models only focus on the individual for appropriate reasons. Stigmatized health concerns can call attention to their families or community and create shame-based discrimination. And the importance of modesty and nonverbal communication. So Native people are, I consider myself to be a modest person, and there is a lot of nonverbal communication, you know, not just in Native people, but even non-Native people, that just by reading someone's behavior and the expressions on their face, maybe sometimes you can just tell by looking at somebody, like, are you, you know, are you feeling okay? So looking at the nonverbals. And you're right, Steve just chimed in there with nonverbal is about 85% of, you know, what we hear from our people. So I was always told you're hearing with your eyes in the work that we do. So we don't look at the medical model of focusing on the individual. You need to be mindful of that person when they come. A lot of them are coming in as representatives of their family and their community, and not wanting to create any shame-based situations. And one example that comes to mind that I've shared here with my own staff is the AA. And again, I have a lot of experience off the reservation where I know people that attend self-help groups such as AA or NA in treatment programs. I've seen them do much better in treatment than those that don't participate in that. Again, we can't force them to, we can only encourage it. There was a time that a lot of criminal justice referred clients were mandated to attend AA and NA, like they had to attend so many, or they would get, you know, sanctioned or face consequences for not doing so. And as time went on, I learned from my own family that attended treatment that they didn't like it. It just, for some it actually enhanced that shame of someone who is struggling with substance use issues. So I'm glad that, you know, even here I don't enforce that. We do have someone who does come in and volunteers to run our AA group here, and you know, it's here for the clients that want it. Understanding the roles of Western medicine. For many Native people, Western medicine has ties to historic and traumatic experiences. For example, there were some sterilization practices that took place that never should have happened, that several women that went to Indian health services were sterilized and not of their own will. This was something that, again, the federal government did that to women so that they wouldn't have any more children. That was part of the genocidal acts that had taken place. And then there are the medical models also tied to other non-native experience, such as the Reservation Acts, the Exploitation of Natural Resources, and the Government Relocation Acts. So oftentimes I have to, I guess, like I said, I grew up Arapaho, and so I was raised with native healing ways. So being able to, we were just looking at pictures of a treatment program that my staff got to take a tour of last week while I was at another training. And they were just fascinated that the whole building was centered on native culture. Like the medicine wheel was in the sunroof of the building, and that this treatment program actually had a room set aside just for smudging. And so, you know, being mindful of our being able to provide that here, we do offer smudging here in our building for most of our groups, with our counselors here that do provide that for the clients. And some of our staff from other programs say that you know, that's what they like to come here for. They're like, they feel like there's this traditional vibe that's in this building when they come here. So I take that as a compliment when they share those comments with me. Providing formal introductions. Again, this is just a customary practice in Native communities of identifying who you are. Oftentimes I go to the Indian Health Services here, and people come up and start talking Crow to me. And I have to tell them, you know, I'm not Crow. I'm not from here. And so then they're like, where are you from? You know, and then I've noticed people know that I'm not from here, but for the most part, I've had a really good experience being here. So professionalism can discourage personal interaction. So I really try to participate in community events that are taking place in the community. So if they're having basketball games, like they have Native Days coming up, and when the very first day that I got here, they were having a walk and a run early in the morning, and I was like, I'm gonna go there because that's something I like to do. I like to go walking, and I like to participate in those kinds of events. So I'm looking forward to that happening again. So I have my post office, you know, mailbox here so that I can go be in the community and check my mail, and I frequent the stores here. So, you know, letting people know, you know, I'm just like everybody else. And again, shaking hands is necessary. I with this COVID, I don't feel as, you know, as much, but they often do shake hands here. Small talk is a great way to gather information about the patient. So a lot of times, like today, this event that we're having, the staff asked, can we have the clients help us set up for this event? And I'm like, sure. I said, that's a good way for them to feel, you know, feel like they're being helpful. So there's no reason for them not to participate in that. So they actually get to work alongside the staff and setting up to go do this feed for the community. Go to the next slide. I'm trying to just now notice where we are with the time. Confidentiality, a big, huge one. People can be really distrustful of Native and non-Native service providers. And like I said, it's because of experiences that people have had in other situations that they just don't feel comfortable. That personal connection, our relationship with Native service providers. And there are times I step in for staff and I'll cover a group for them. Maybe they need a day off or something came up that they can't come in. And so, you know, I'll jump in groups. And I really like when when the clients that attend the group say, where's, you know, my staff person here, where is she at? We really like her. She's just like us. And she's one of our people that comes, she's, you know, in recovery herself, but she's been she's been in the streets, and she shares that story of, that was me at one time, and now she spends her, it's her job to help people, and she really has a passion for it, and she's really good at it. And it makes me feel good when our clients come in and, specifically request her, or another person, because they know, they're like me, they understand what I've been through, so they feel comfortable with them. Sometimes it's just sometimes some people, females might not want a male person, and they want a female. So my staff is kind of half and half here. It wasn't like that at first. When I first got here, we just had one male, and now we've got more. So it's kind of balanced itself out here. Might help to explain the process step by step, to, letting them know everything's going to be confidential. Our charts are locked in a locked file cabinet in a locked room, and nobody has access to that. I'm really working on increasing that to digitizing and going electronic with more of our documents, so that they're more secure. And help to explain who has access and who doesn't have access. Explain the reasons why you need to disclose, report self-harm. Again, that professional disclosure statement will cover that. And sometimes these people come with some very serious issues, and we have to respect their confidentiality around that. Again, the circular migration of people traveling daily, weekly, monthly, from reservation to rural communities for work, school. You see the romance is on there, shopping, and treatment programs. Some people have, I have family that lives right close to Seattle, and they come home for Sundance every year, and they come back for certain ceremonies. And I was taught by my grandparent, I can go wherever I want, but when certain things are going on, I need to be home. So that's just something that's ingrained in the way we live our life. You can go to the next slide. More on the circular migration can be a challenge to treatment plan adherence. As a result, a Native person might be labeled as resistant, non-compliant, hard to reach, or unmotivated. So having that communication with them to understand that there may be situations, and I don't think that we've encountered any of that here. And I know a lot of places, once they get there, they have to stay there. So yeah, I can't say much to that one there. Especially supervision, administrative, evaluative, and clinical. Making sure that you consult with your supervisor so that you can get help with decisions that you might need to make. We have staffing here every week. I have a clinical supervisor here, so she sits in most of the time. That is her job, that she oversees that whole process here. And sometimes it's not always available. Like I said, I've made friends with the Indian Health Services psychologists so that I have somebody to talk to. Sometimes we have some challenging situations that comes up, especially with our crisis work and on-call situations. Might not always be helpful, the supervision, depending on the type of supervision that you're getting, might not always be what you need. Sometimes we might need to seek someone outside of the agency to help with certain situations. It is your ethical obligation to seek clinical supervision and not work under case evaluation only. So we pretty much work as a team here, and every week we have our clients that we need to talk about, and we do that every week in our staffing meeting. So we go over the new people and we update on people that are attending the program now. So when you're a clinical supervisor, you're providing supervision as, the administrative supervisor. Sometimes you're dealing with your staff kind of like from a counselor viewpoint, and some as a consultative viewpoint. So I'm real familiar with the discrimination model, and that looks at the kind of multidimensional role of a clinical supervisor and what their role is in providing services. And I have an open door policy. CARF requires you to have an open door policy. So I oftentimes get staff that come in and, you know, they have a situation that they need to talk about. So I'm always glad that they understand and they know when they need to seek that help. And sometimes, you know, maybe we need to get them some training. So supervision is real important. The 3 goals of an effective supervisor are delivering quality treatment services, creates a positive work environment, and develop staff skills. So I've had some wonderful supervisors in my lifetime, and I've learned a lot from them. And, you know, people with a lot of experience have a lot to share. That's always been real helpful. We can go to the next slide. We're almost done here. Effective supervisors give clear expectations that are understood, give feedback in a respectful and timely manner, teach or demonstrate needed skills, provide a supportive and respectful environment, leads by example, facilitates meaning, purpose, and manageability in the workplace, promotes self-care, and models said concepts with the supervisee. We all need to manage the stress in our lives, so self-care is really important. This work that we do is not easy. It's very tough. It's very challenging. And the better health that you're in, the better able you are to manage the stress that comes along with this work that we do. So I really like to encourage everyone to make sure you set up some type of a self-care for yourself and not wait till you're burnt out or tired to feel like you need to do something, but just creating these little mini habits into your daily routines to help yourself, you know, get through each day that you have to work, and being able to set those boundaries between your work and your personal life so that you can be with your family fully and, you know, separate yourself from work. Can go to the next slide. There are the biopsychosocial stress. So biologically, you know, stress can affect us on all levels. You know, every sickness that you can think of can be caused by or exacerbated by stress, psychologically, from thoughts and feelings. Sometimes our clients, like I said, they can come with some trauma stuff. And so we need to be able to hold space for those people. And also sociological, looking at the surrounding environment. Some of these people come from some really challenging home environments. So some examples of stress symptoms might be skipping rest and food breaks, binge eating, working too much, not taking time off. I've seen that from some people. More physical complaints, change job performance. Some may self-medicate, sleep too much or not get enough. There may be emotional changes. I like to tell people, check on your colleagues, you know, make sure everybody's feeling good and doing good. So not only, you know, knowing about yourself, but being mindful of how is everybody doing that you're working with. And go to the next slide. Sorry, we're running short on time, so I'm kind of going to speed it up just a little bit. We want to be mindful of burnout. You know, you don't want to overdo. That requires really good self-care. So, you know, watching what you eat, getting a little bit of exercise every day. Like I said, the better health you're in, the better able you're going to be able to handle your workload. Because this, like I said, this work is tough. It's not easy. And we can go to the next slide. There are some developmental stages of burnout. So fatigue can set in. You know, when you first start, you're happy with your job. Fatigue can set in, chronic symptoms, physical effects, crisis can develop, hitting the wall. I can speak to this with my 20 years of experience. My first job off the reservation, I think I burned out in 2 years, like really fast. And I had to really realize, I actually questioned what I was doing. And only to change my job and find out I was perfectly happy with the next job. So being able to find what fits you. I suffer with migraines, so I really have to do a lot of self-care to prevent those. The next slide. Simply put, for sustained, unmanageable, painful stress, your response is your responsibility. You need to know when to ask for help. You need to set limits. You need to be able to say no when you need to say no. Manage those symptoms that you have. Explore new interests. Maybe there's something you always wanted to learn and haven't. Maybe you want to try meditation, or I keep saying I'm going to do yoga. I haven't done it yet, but I hear a lot of really good things about what it can do for you. On to the next slide. Again, we can't emphasize enough self-care, help for the helpers. The greatest gift you can give your patients and your family is taking care of yourself. We often work with our patients on taking care of themselves. Practicing what we promote takes on even more significance. Considering, employee assistance program services, this can give you access to little or no cost confidential therapy services. Next slide, stress management. Humor. I love funny movies. I like to watch ridiculousness. I have I just have some favorite funny movies. Meditation. YouTube has some free meditation music you can listen to. There's apps out there. Ceremonies, that's how I ground myself. Traditional type of ceremonies, prayer. Us natives, we pray with the beginning of each day that we do our work. Learning relaxation techniques and exercise. Exercise is like the biggest investment you could put into yourself. It helps with everything. And you don't need to, run a marathon. Even there's studies that show simply walking 10 minutes, a couple times a day. Just doing little things at least 3 or 4 times a week will really help. Just find something fun to do for yourself, something that you enjoy. And that wraps up today's presentation. Thank you all for taking time out of your busy schedules to attend today. And if we have like a few minutes, so if there's any questions.
Well, thank you so much, Avis. Yeah, we've got a few minutes. I know there's been some great comments coming through on the chat. I've been trying to respond here and there and watch those. So I appreciate everyone's comments. And anybody want to throw a question out or a comment here in the closing moments? Feel free to unmute yourself or maybe post something else. We're getting a lot of thank yous. Thank you guys for staying with us for this past 90 minutes. And 90 minutes of Zoom time is equivalent to like 6 hours of real time. So it's very, very admirable that you all stuck with us, and happy to have you here. Closing questions or thoughts from the audience?
Everybody's probably ready to get back to work.
That's right. Well, take a few minutes before you jump back in. And oh wait, I have. It looks like Albert's unmuting there.
Hello, Avis. I just wanted to say thank you. This is the second time I've sat in one of your presentations in the past month, and so it's good seeing you around. Thank you for your work and your presentation. I really took away a number of things that I recognized and have utilized in my own practice, and just kind of reinforces, as the cultural awareness and the importance of building our work on the foundations of culture and tradition, ceremonial and spiritual practice. So I just want to offer gratitude and say thank you.
Thank you. Appreciate that.
Well, again, I want to thank Dr. Garcia for another great presentation. And Albert, I appreciate your comments, and others that have been active on the chat, and even those that just sat back and absorbed and enjoyed this. Your presence is noted, and we're happy to have you all. So we will reach out to you via email post-event with some information, and you can always reach me here at the center. And I can certainly forward along questions to Dr. Garcia too, if there's any questions you may have. So we're going to broadcast again next month, first Wednesday. Avis, what do we have up next? I think we're going to talk about SUDs, HIV, and STIs, and issues related to that and the work that we do. So it's another very informative topic. So please feel free to join us if your schedule will allow, and we'd love to see you again. So until then, I want to say Tokcha, take care of yourselves, stay connected, stay healthy, and everything will be okay. So we're happy to have you on. Thank you so much again, everyone. Have a great rest of your afternoon and the rest of the week. Thank you. Miigwech.